Authorities and the World Health Organization say an outbreak of a plague is being contained in the country. The World Health Organization has also said it is unlikely the plague will spread beyond the country's borders. Since August, nearly 2,000 cases have been reported. Nearly 130 people are dead. But the number of pneumonic plague cases are reportedly decreasing in Madagascar. Still, health authorities across the region say it is not time to celebrate just yet and are calling on people to remain vigilant. Well, let's get you an update on that story. I'm joined on the line from the Malagasy port city of Tamatave by CGTN's Voldi Karese. Voldi, some hope there that the plague is being brought under control. What more can you tell us about that?
Certainly, Beatrice. I think that for a lot of people, particularly in the capital, Antananarivo, where the biggest threat was because people live in such cramped and squalid conditions, and the fact that this plague is different because Madagascar gets cases reported of bubonic plagues annually, but this is pneumonic plague. It is possibly through coughing, getting the contagion is spread through getting an infected person sneezing on you, and this was the biggest concern for people, is that this time it was actually airborne, which is why at the beginning there was such a high number of cases. But now the World Health Organization say those cases are tapering off, but of course they are still advising people to be vigilant, to take necessary precautions.
Voldi, what sense have you been getting though from people in the capital Antananarivo about this outbreak? How worried are they exactly?
They're certainly not very worried. The schools reopened again on Monday after the reopening of the new term had been delayed because of the plague. It reopened again on Monday, and that has given people a lot of confidence, I guess, to get back to normal. Whereas a few weeks ago, you would see people walking around with masks across their faces to protect them in an effort to not catch the plague. Now that's no longer the case. In fact, I spoke to a couple of people who said they didn't actually believe the plague existed, and this was just another means for the government to get some money. So trying to convince people that this outbreak is actually real has been one of the challenges that health authorities have faced here in Madagascar.
And Voldi, what more can you tell us though about international efforts to help contain this outbreak? Who exactly is involved, and how is the public responding?
Well, the World Health Organization has obviously been on the forefront. They moved quite quickly together with Madagascar's Ministry of Health in order to contain the outbreak, but also the Chinese medical teams have been here in Madagascar for a few years, but just this week, 4 new specialists arrived to come and try and help as they try and contain the latest outbreak of pneumonic plague. The response from people has been very, very positive. But like I said, it's early detection here that is the key. The pneumonic plague, it kills within 1 to 4 days, which is incredibly fast, and it is recognized through a sudden spike in fever. And so at various bus stops, you actually have doctors and nurses now manning these tents. It's early intervention where they take people's temperatures before they're allowed to board, to travel wherever they may be coming. So today we made the journey from Antananarivo to the eastern port city of Tamatave, which is about an 8-hour drive, just stopping and checking along the way whether or not people are being checked. And we did see that kind of preventative measures still in place.
All right, Voldi Karese joining us there from Tamatave in Madagascar.